Hi, everyone. I'm Catherine Sanders from Sanders Consulting, and I'm going to talk a little bit about leading system change today. So, hopefully, spend about 10 minutes talking about a foundational concept. So, last time I talked about fundamental attribution error, which is like a fancy, complicated way to say that we tend to think that people's behaviors are mostly because of their own personalities when it's also true that behaviors are heavily shaped by the situations that people are in. So that's what the whole field of social psychology is about, the person and the situation, right? So if we know that the situations we place people in have a huge impact on their behavior, then we want to be careful about the situations that we place people in, right? So um, that leads me to talking about what it means when someone says change the system, right? So you hear that a lot, especially the last few years, and it makes me very happy as a systems engineer to hear that people are interested in redesigning or totally transforming our current systems that haven't been serving us well. Some of our largest systems are in terrific need of reform or transformation. So you can think of governmental systems that humans have built. You can think of educational systems that humans have built that haven't been functioning as we'd like them to. You can think about work systems that we've built that are burning people out, that are causing harm to employees and or to clients or patients or students. Um, we can think about economic systems that we've built that are unsustainable, that are leading to huge gaps in income equality or huge problems with environmental sustainability. And so we've got a lot of our systems, healthcare, education, economics, mostly sort of any sort of work system that are unsustainable because they've been built in ways that take us down a path that does damage to people and to the environment. So when people say change the system, I think that's fabulous. And we need to be more precise in how we're talking about this so that we can actually collaborate and change these large systems that shape our lives. Um, so today I want to talk about what people mean when they say the phrase change the system and bring it to a place where we can actually get on the same page with each other. So on my website, you can go under programs and systems thinking and download a handout. And there's this iceberg drawing about systems thinking that I'm going to be referring to that'll be really helpful as you think about the kinds of change to systems. So at the very top level of the systems thinking iceberg, we talk about the events that we can witness or that we can participate in, right? And those events are things that have already happened. So we can sense them, we can document them, and we can experience them. But after something's happened, it's a little late to change the system, right? So we can change how we react to an event, but that doesn't prevent that event from happening again. So if we go a level underneath the events level, underneath the waterline here in our iceberg, we're then talking about anticipating these events before they happen. And we're going to try to collect data, and we're going to try to model and predict when something might happen again so that we can try to prevent it, so that we can react to it faster or more effectively. And these are usually the levels that we're talking about: how to react to something or how to anticipate something happening so we can react faster or better or prevent it at the last minute as it's starting to happen or just before it happens. So these are usually the areas we're talking about. If we think about societal issues, societal systems and problems that we're having in the United States, if we think about policing, so we have an event that's already happened, and then how do we react to it? So how do we help people who have been harmed? How do first responders come and take care of them if somebody's been wounded? How do we get justice about things that have already happened? So these might be things that people are talking about in terms of system change, right? And those are valid and those are important. But then how do we anticipate those things? So when you hear people talking about, well, what are the things that are likely to lead to a bad policing event? So maybe it's that we should have mental health professionals or mental health training for police who are responding, or mental health training for people who show up at an event to prevent something happening, a shooting from happening. So we can anticipate them. Well, what are the things that lead to these bad events, and how to reduce the likelihood that it's going to happen or to mitigate it? How do we train bystanders to intervene in a bad event, right? So usually these are the levels that people are acting in, and they might also be levels that you're inside an organization. If there's an event you're trying to prevent, like a safety event or someone getting harmed at work, your safety and quality control people might be gathering data to predict when those events might happen and how to get in front of them. But when we talk about change the system, what many people are actually implying is going deeper. Well, what are the structures here that lead to these patterns that eventually lead to these bad outcomes that we don't want? And these structural changes are usually what people are pointing to when they say we need to change the system or transform the system. So what does it mean to change a structure? Well, a structure is something that leads to a pattern, right? And so when we design structures, so we design the job of policing, and we design our communities, and we design the work that's available for people to do, and the housing that people live in a community, that's structure. So structure is the design of the community, or the design of the job, or the design of the organization. And when we start to change those structures, then they lead to new patterns, which then lead to new events, right? So we definitely want to be thinking about structures when we talk about system change. And the most powerful thing we can do is rethink these mental models here that lead to the structures that we design. So if we're going to use policing as an example, our mental model might be community safety, right? And so we just step back, we step out of policing altogether for a little while, and we think about, well, what makes a community safe? Well, people have work and adequate incomes, and people have affordable, clean, life promoting housing, and people have green space to play in, and people have an educational system that supports them, and people have access to good quality health care and preventative medicine. And we have healthy food that is available, and we have people feeling valued and respected by each other and by the services that serve them, right? And so we think about safe communities, and then within the context of safe community, then we think about, well, what does policing then look like, right? So are we policing to preserve property? And if so, what does that look like? Or are we policing, excuse me, to improve public health? And what does public health look like? What does that service look like? And do the police actually need to respond to public health emergencies, right? Or what happens if there's a criminal activity, there's a robbery, or there's a shooting? Then who should respond and how? So the structural change comes from changing how we think about what we're trying to do. So we actually change the goal. So instead of incrementally improving policing, what we do is we step out of it and we say, I want to design safe communities for citizens in the United States. What are the elements of safe communities, and what does this community need, and what do they already have, and what do their people view as safe? So we include the people we're serving in this design of safe community, and from that larger context we design what the next evolution of policing looks like. So what does it mean to protect property? What does it mean to protect people? What does it mean to respond to health emergencies? How do we keep people healthy? How do we employ people? How do we house people? So we look at it through a whole systems lens. We don't do incremental change to an existing service if we're talking about structural change. So it's been about 10 minutes. The time flies really quickly. Thanks for joining me. Next week at this time, I'm going to be talking about structural change within a work system. So I'm going to, instead of talking at the societal level, I'll talk then about what does it mean to change the system within an organization. Thanks for joining me. I'm Catherine Sanders from Sanders Consulting. If this is the kind of conversation that's interesting to you, you can find out more about me and my work at catherinesandersphd.com, and feel free to join my membership group, Leading System Change. You can find out more about that at leadingsystemchange.com. Take good care.